You have to think about accreditation. All of these things have to do with the managerial side. Now you have the economic support part. That comes from health insurance, the financial portion. Health services have to be financed. That's the major portion of the health system. Health insurance is the major financing mechanism for the U.S. health services system. Health insurance is the major financing mechanism for the U.S. health services system. In other words, these services are not free. Someone has to pay for these services. Whether you do it as a private commercial payer, whether you do it through a third-party payer, such as an insurance company, or whether it's through workman's comp, these services have to be paid for. So that particular section of the book, Economic Support, is about all of the financing section. The next part of your book is on resource production. Now, this has to do with health services workforce, such as individuals who are working in health services system that help to provide these services. The major or the main person, number one, being the physician. And then with physicians, they have parts they have to play in the health services system. They can't just go out there and say, I want to practice medicine. They have to go through medical education. They have to go through training. They have to do residencies, because they have to make sure that they're providing the services they need to provide to you as being the patient. Resource production also involves hospitals. And when we get to that section of the book, we're going to talk about several different types of hospitals. There are several different types of hospitals who all work up under the umbrella of the health services system. And we're going to talk about them later on when we get to that chapter. We're going to talk about each one of those different types of hospitals and the service they perform or they offer. Another portion of resource production is biomedical research. And as you know, UAB is one of the top health services system that does a lot of case studies, research. They're always looking and finding ways for cures for this, for that, etc. You have the Cancer Hospital, you have St. Jude's. All of these type of specialty places, they're always doing research, ways in which they can find cures for a lot of diseases and conditions that have prevailed in the U.S. health services system. The next part of your book is the delivery system. Now, this is where we get into health disease, health promotion, and prevention. And then we talk about primary care and what it offers, secondary care and what it offers, long-term care and what it offers, tertiary care and what it offers, palliative care and what it offers. We also talk about the care of special populations and special disorders. And in this chapter, it mainly deals with what we call mental illness. And what a lot of individuals don't realize is that mental illness is a significant part of the health services system. Those individuals are cared for just like any other individual in the healthcare system. So they have their hospitals that they go to. They have physicians that cater to them based on their illness. They receive meds. They have things that they partake in the healthcare services system just like any other individual. So we will talk about that later on when we get to part 6 of the book. The last section of your book mainly talks about how we measure outcomes of the delivery system and what issues do we have in quality care. Now, when we get to those sections, that's when we'll talk about benchmark scores, score ratings. We'll talk about things that you can do in your facility, such as surveys, things that you can put out there to the public that will give you feedback on things that you're doing very well, on things that you could improve on, and on things that are just absolutely not great at all. So we will talk about those issues and those particular components of the book later on in the class. So to begin our discussion for today, chapter 1, I'm on the slide, the very first slide. It's just an introduction slide. Delivery of health services in only one facet of maintaining one's health. Health services are shaped by the economic, political, and cultural values. So I have a question up here that says, what factors influence health status? Okay? What factors influence health status? When you look at that question and you think about that question, there are so many different things that can, or shall I say, factors that play a big part in how health services are influenced. For example, one of the biggest things that plays a major part of an influence in health status is the inability to obtain health insurance. That's like one of the main factors. I say that because you and I both know that without the level of health insurance that is needed for every individual, without that, our healthcare system will always suffer. Even as a healthcare manager, you may not think that it doesn't affect you, but it does. Because guess what? It affects your level of clientele. It does. It affects your ability to operate your facility on a functional basis daily, because it's almost like you really don't know how your day is going to go. You know, and it's almost like you have to plan it daily, because guess what? January, February, March may be awesome months for your facility. You booming, you know, you got the clientele, everything's good, grand, gravy. But now April hits, and then the economy has taken a turn. Even if it's a slight turn, the economy has taken a turn. So now, depending on what that change was, will also depend on what happens into every facet of any operating system in the U.S., whether it's healthcare, whether it's retail, whether it's automotive, whether it just really doesn't matter. When we focus in here, we're focusing on healthcare and how services are delivered. But the ultimate thing we have to remember is that, guess what? You can have the best operating system ever. I mean, organized, just wonderful. But if you don't have the financing part of it down to a T, your facility, your organization, your business is going to suffer. So one of the factors that influence health status is health insurance. Another factor that influences health status is health promotion, health disease, health prevention. Because not everyone has access to health services. Not everyone is educated enough about different diseases and conditions to know what it takes to prevent that disease from happening to you, or to prevent that conditioning from coming upon you. Or not everybody is educated as they should be as to these are the things that you need to do every day to live a productive life, a healthy lifestyle. when we look at the next slide, organization of health services. Okay, so how are the organization of health services done? Governments, one. Private and public sectors. You have voluntary or charitable services. But the one thing that I want you to remember is what I have as bullet number 4. Your delivery of health services primarily occurs in the private sector. Most occur in the private sector. Private sector being your doctor's offices, your hospitals, and things of that nature. Your public sectors is more or less your public health departments. But most health services are done either in a doctor's office or in hospital. Next slide, management of health services. Okay, that comes through planning, administration, legislative, regulation. Now, we're going to talk about those in later chapters. We are. But one of the questions I have up here is, why is regulation important in the medical field? Okay, so let me tell you why regulation is so important in the medical field. Now, with regulation, one of the things you have to understand is you are going to have to be bound by rules and authorities and policies and procedures. In other words, you can't operate a healthcare facility and you're not following any regulations, whether it's local, state, national, government, health department related regulations. Doesn't matter. If you're not following regulations are no more than rules, policies, procedures, things that say you can, you can't. If you do, this happen. If you don't, this happen. That's pretty much what it boils down to. You may plan it out, as I got as first bullet. You may have an awesome administrative team. You got legislation. But if you don't have regulation, you don't have the full package for managing whatever health service is that you're over. Access, costs, and expenditures. Next slide. What influences, what impacts the cost of care? Inflation, that's one. Your increased volume of services. What do I mean by that? The more clients you have, the more revenue you generate. Demographics influences our cost of care. How does that happen? Well, if your facility is in an area of low income individuals that's coming to your facility, not that you're not generating revenue, but you're not generating as much. Sometimes you may be prone to increase your cost of what you're charging so that you can profit more. Whereas if you're in a section that is middle class to high class, you really don't have that issue. You might even would lower your costs just a little bit, because you have a clientele. You're not worried about that, but you can have such a high clientele and still have outrageous prices, and you still could not come out on top because your pricing is so expensive. Health insurance coverage, of course, I already talked about that. So one of my questions is compare and contrast the availability of health care in low-class populations versus middle-class. I can give you that. Basically, middle-class populations are going to have more access, or shall I say, health care is going to be more available to them. Truth be told, when you got health insurance, you can get a little bit more. A lot of times when you don't have health insurance, a lot of facilities want to pinch back and not give you so much stuff because you're really not giving back to them. It's almost like I'm going to provide the service to you, but then I want you to pay me for this service. And if you're in a middle class population, you don't really have that issue. But when you get to your low income, you run into an issue of that. So with the healthcare delivery system, 10% of all jobs in America are where? In healthcare. There are more than 200 healthcare careers available. More than. In Intro to Healthcare Services, that is one of the classes where in that class you learned about a vast majority of healthcare careers. You will be surprised as to how many different careers comprise the health services system. You will be so surprised because there are just that many. The healthcare delivery system doesn't just involve the services that are offered and delivered. And I say that because you can't leave out the individuals who help deliver those services. So it's like walking into an emergency room. You have the services there. They're there. They're available. But you got to have individuals there to deliver those services. So when we look at the health delivery system, you got to look at the system as a whole. It takes all of those medical professionals along with all of those different type of health services in order to deliver to patients and their families the quality of health care they all deserve. Okay? Another aspect of the healthcare delivery system is hospitals. Now, the one thing that I want you to know about hospitals, bullet number 1, they can be public or private. Private hospitals, they can be profit or non-profit. There are several different types and classifications of hospitals, several different types. We're going to talk more in detail about them as we get into that chapter on hospitals. But I will tell you that most individuals utilize what we call general hospitals. And the reason being is because those hospitals can take on a vast majority of different illnesses and for different ages. Because think of it like this. A general hospital versus a rehab hospital, they're totally different. Because in rehab, what happens in rehab? Rehab is nothing more but, getting you back to that quality of life that you had. So they're focusing on speech, walking, talking. They're focusing on that, the use and the activities of your limbs again. Versus with the general hospital, I don't have to just focus in on that. There's so many other things about your health that I can focus on or that I can treat. But if you go to a rehab hospital, that's all they focus on. If you go to a burn center, treatment center, that's all they focus on. If you go into a cancer center, that's their focus. So even though you have vast majorities of hospitals, they each serve a particular purpose in the health services system. Now, one of the main regulatory departments that plays 100% of its part in the health services system is who we call Joint Commission. Okay? So, anytime you hear JCAHO, you need to know and to remember what that stands for. And it stands for Joint Commission on the Accreditation of Healthcare Organizations. In other words, these are the people that can make or break your facility. They are a regulatory system. Their job is to help you maintain quality of care, not one time, not two times, but at all times. They do that by giving you specific guidelines that you must follow. I'm going to say that one more time. They're responsible for giving you guidelines that you must follow. And the way that they make sure you're following them, they do inspections. They may come once a year, twice a year, once every year, every 2 years. Now, specialty hospitals are those hospitals that are for specific conditions. Now, I just named a few minutes ago. Burn Center, the Cancer Center, St. Jude's. You have research hospitals. You have rehab hospitals. They're specialized for particular things. Okay, but I also gave you in the notes. I had already listed the cancer and the rehab, but look at what else I have up there. I have pediatric hospitals, and then you have psychiatric hospitals, because you have to have a facility for your mentally ill patients. Ambulatory facilities. When I say ambulatory, I want you to know, and I have it in the notes, anytime you hear ambulatory, we're referring to outpatient services. Now, most of you have probably had some kind of outpatient procedure, or you know of someone who has. When they had that procedure done, they were in an ambulatory. They were in what we classify ambulatory facility. That may occur where you were previously once in a hospital and had to have outpatient surgery, or you're having an outpatient procedure to prevent you from having to go in the hospital. Not only do you have outpatient services as an ambulatory facility, but you also have surgical clinics, or shall we say surgery centers. Urgent care centers are types of ambulatory facilities. Outpatient clinics is a type. And you have your optic centers along with your fertility clinics, or shall I say your genetic counseling centers. All of those are classified as different types of ambulatory facilities. Okay, the next type of facility that you have, part of the U.S. Health Services System, is long-term care facilities. Now, these facilities are mainly for elderly patients. Not that other individuals could not utilize it, but it's mainly for the geriatric patients. The purpose of long-term facility, they care for anyone who has a handicap or a disability and going to be incapacitated for a significant amount of time. Long-term care facilities also have what you call residential care. Another name for that, we just usually call them nursing homes. Okay? What occurs there? A variety of things, but it's basic physical care that's given to patients on a routine daily basis. There is a long-term care facility known as extended care. Sometimes you may hear it called skilled care facility. And this is where they provide just what it says, skilled nursing care and rehab services. Again, the long-term care facility is geared toward elderly patients, but there's a possibility of other types of patients having to utilize a long-term care facility. One last thing on long-term care facility is like assisted living facilities. Now, the one thing about assisted living, most of these patients in these facilities are independent on their own. They actually have their own little house, and they have meals and housekeeping that's provided to them. They get basic medical care services. They pretty much, a lot of them can take care of themselves, pretty much stay by themselves, but they're still in a area where someone comes and check on them and see about them and make sure they're okay. But it's a way to give them the ability to live by themselves, but yet be, how shall I say this? Yet be supervised by individuals. Although they're living by themselves, there's still someone there in the facility that helps to monitor them just to make sure everything's okay. Okay, now another part of the health services system is our home health care. Home health care is a lot less expensive than being in a hospital for a long period of time or being in a long-term care facility. A lot of times these individuals may come to your home. Most of them come to your home, and they provide the necessary things that you need inside of the home. They have to be state licensed in order to provide this service. Now you have your medical and your dental offices as part of the healthcare services. There are a vast majority of them. A lot of those medical services offer different variety of services. They have different types of specialties tied to them, and it includes all types of healthcare professionals. Your mental health services. Your mental health services in the health services system, those involve your psychiatric clinics and hospitals, but there are also counseling centers that are offered for mentally ill patients. And a lot of times what you have to understand is with mentally ill patients, the counseling centers don't always, it's not always for the patient themselves. A lot of times the counseling centers is for the families. You're trying to deal and cope with, a mentally ill or a mentally disabled loved one. That can be hard. Mental health services also offers abuse treatment centers, whether it's for drugs, whether it's for alcohol. They offer that type of health service to those patients. You not only have drug and alcohol abuse, but if you need physical abuse treatment centers. And keep in mind, physical abuse can occur with in the category of child abuse. It can occur in the category of spousal abuse, whether it's the man or the woman. And it can also occur in elderly geriatric patients. Okay, another part of the health services delivery system is our government agencies. And we know those are our local officials, state officials, national officials, international officials. I put a slide in here with some pictures so that you would know some examples of government agents. You have the VA hospital, health departments, and then you have your national facilities. You have your Joint Commission, you have CLIA, you have NIH, National Institutes of Health. NIH, National Institutes of Health. These services are supported by taxes. Centers for Disease Control, comes by way of the U.S. Department of Health and Human Services. Why do we need CDC? We need CDC whenever we have a concern with outbreaks of conditions or diseases. When we have a concern with anything involving our health and our safety. So when you go into the CDC for Disease and Prevention website, there's so many things up in there. They have a section called Health and Safety Topics. Pretty much just about any topic you want to know about. Centers for Disease Control has information on that topic. They have a lot of particular topics that are very popular that they keep on the front line of their website so that you can see that information firsthand. But the CDC, Centers for Disease Control, play a very significant part in the health services system. We have to have them. Next slide, we also have to have FDA. FDA, of course, is for the Food and Drug Administration. We have to have that because we need somebody somewhere to be responsible for how they regulate food that we consume and drugs that we buy and or purchase that is sold to us. We need to make sure somebody has inspected the drug, They know the side effects of the drug, and that information is passed down to us, the patients, the clients. WHO? World Health Organization. This is an international agency. Okay? Basically, what their job is they do a lot of statistical work. They compile a lot of disease statistics. They help to give information on ways that we can promote healthy living. Anytime there's any kind of serious health problem that has broken out across like international, across different countries, and is traveling, their job is to make sure they get that information trickled on down to the individuals per state that need that particular information. They too play a significant part. The next agency is OSHA, Occupational Safety and Health Administration. These individuals are a part of the Department of Labor. Basically, OSHA works for you. OSHA works for you as a patient. They work for you. Why? Because they make it mandatory that your facility Okay, then we have our public health systems. Now, the public health system, these are classified as our health departments, of course. Now, they are kind of broken down in two different divisions. Okay, you have your health, and then you have your human services. We have health departments that provide services to both states and local communities. And just to give you an example of some of the services that they offer, I have those listed in the bulletin. Immunizations, health statistics and records, health education. Those are just some of the services. Those are definitely not all of them, because they provide WIC services for individuals who are pregnant with small babies. They provide those services up until a certain age that child gets. So they don't just, and then too, there are some services that you can go to the health department for. Some individuals actually go to the health department to see physicians. So like I said, they offer a vast majority of services to help with any kind of health care and prevention needs that patients have. You have your Veterans Administration or your VA hospitals. They're supported by the feds. They have hospitals for their VA members, but they also offer different other services. And these are strictly for those who have served in armed forces. For all the veterans that have actually served in the Army, they have great benefits through healthcare services for them. Okay, the website associated with them is the VA.gov, which is the United States Department of Veteran Affairs. Now, you have nonprofit organizations, part of the healthcare system. We call them voluntary agencies. Basically, they just kind of help with funding that can be used for research. They provide funding that may help promote education, whether it's in schools, in the communities. They offer other different types of services for individuals that are diagnosed with certain diseases and conditions. Some of those being March of Dimes. And if you did not know, Franklin D. Roosevelt actually founded the organization of Marching Dimes back in 1938. He actually had a condition called paralytic poliomyelitis, which inflammation of his muscles, paralytic, of course, pertaining to being paralyzed. But he founded that, and basically the initial goal was to find a cure for polio and develop a vaccine for polio as well. Now today what we do in lieu of March of Dimes is we try to focus and captivate information as it pertains to birth defects. A lot of things are being done nowadays to prevent birth defects and to reduce our rates of infant mortality or infant deaths. You have your American Heart Association. It was founded in 1915 by a group of cardiologists. Cardiologists meaning individuals or specialists who specialize in the heart. What is the mission and the goal of the American Heart Association is actually to reduce cardiovascular diseases and strokes. They do this by way of research, education. They offer different type of community programs, and fundraising initiatives, educational initiatives to kind of get the word out. They get themselves involved in nutritional aspects of it because a lot of cardiovascular diseases and conditions can be prevented through diet and exercise. You have HOSA, HOSA. This is the Health Occupations Students of America. Now, this is a non-profit student organization. And basically what they do is try to promote careers in healthcare. Trying to get people to think about going into a healthcare career. Nursing, respiratory, dietitian, nutritionist, medical lab tech. That's what their focus is to try to help with promoting those career advancements or career opportunities. Hospice is a significant portion of the healthcare delivery system. Again, you're going to see a lot of this in later chapters. Chapter 1 is just your introductory chapter. Hospice, as you know, are the healthcare systems that provide palliative care for patients. So basically with palliative care, your job is not to you're not doing things to prevent them from dying. What you're doing is making them comfortable, so to speak. You're just trying to make them comfortable. You're just trying to give them, warm blankets, and you give them something for pain, and you're just doing things you can to keep them as comfortable as possible and let them live out, their last few moments or their last few days or their last few weeks on earth. Now that pretty much wraps up chapter 1's PowerPoint notes. So we're going to slide right on into chapter 2. Not very long chapter, but chapter 2 is just an overview of health services system and its users. Okay. Now, in the U.S., at least $2.2 trillion goes into public, private, and volunteer programs to help deliver healthcare services. Okay? Now, with that being said, I need you to understand how the healthcare system is broken down and that money is distributed. Okay? So it's what we call 5 subsystems. 1 is the employment-related system. 2, poor and uninsured system. 3 is your VA system. We just talked about that one. 4, workman's comp. And 5 is active duty. So we're going to talk a little bit about each one, really briefly. So for the employment system, at least 1/3 of finance is spent on the employment system. At least 1/3. And I want you to think about it. Most of the time when you go and get a job in the healthcare system, you have to go through training, correct? Most of the time, that's what kind of training? Paid or unpaid? Paid training. Now, who's to say that when you go through the training, you're going to stay with the company? Most do, some don't. So not only do we pay for your paid training, think about when you've been on a job, and let's say, for instance, a year into the job, you got to go out of town for training. Most healthcare facilities will pay for the expense of that. Okay? Then I want you to think about all of the different individuals that are working in the healthcare system with you in whatever department that you're working in. All of them are paid different types of salaries because it depends on, what their occupation is. That's money that goes into healthcare expenditures. So again, at least 1/3 of our employment system is tied to healthcare expenditures. Now, as far as the poor and the uninsured system, that is mainly supported by taxes. And with that being said, the financing for that in the healthcare system really depends on individual incomes. That's what it really depends on. A lot of those individuals, that if they're not working, they're already getting some type of government assistance. So by them already getting some type of government assistance, the government is really paying for their healthcare needs. You got your VA system. We've already talked about that, supported by the feds, but it's only given to military veterans. And it is based on their length of service or the length of time or service that's connected with the disability they have. Okay, you have workman's comp. Workman's compensation is pretty much designed for anyone that gets hurt on the job, injured on the job. They don't pay. It's not like they pay like 100%. It's more or less like they may pay like a percentage of whatever. But if you get hurt on the job, workman's comp is responsible for that. But again, don't think you're going to just be kicking rocks. No, don't. I mean, ain't that kind of money. They going to take care of you, whatever. But pretty much when you get yourself back up on your feet, you really need to go on back to work. Active duty military system, only for those who are actively in the military and their immediate dependents. So those are your children, okay? That ain't for the aunties and the uncles and this, that, and etc. That's not living with you. You're not providing support for them. Just because you're in the military, they don't live off your benefits. Your benefits are for you, your spouse, and your dependents that are living in the house with you. So what do we mean when we say need, demand, utilization? Now, how do you know that you have a need for healthcare services? Well, basically, based on what your ailment is, what your issue is, what your disease is, what your condition is, determines whether or not you have a need for what you need for what you need. And then if you have that need, your demand is how often you have of need. So, with that being said, if I'm a general medicine facility and I take care of pretty much anything that is generally related to your health, your colds, your sinuses, your sore throats, your headaches, any of those general services, my services will always be in demand for that. So in other words, as you go out and apply for your jobs, whether you're going to be working at a doctor's office, nursing home, assisted living, your facility will always be in demand. And I can give you an example. Long-term care assisted living facilities, those are your baby boomers. As your population ages, those services increase. There's a greater need. The greater the need, the greater the demand. The less the need, the less the demand. How does utilization play in that? If I got a great need for something, I'm in high demand for it, I'm going to increase in my utilization because that's the amount of the services I'm actually using. Versus if I don't have a great need and I don't have a high demand, I'm going to decrease in my utilization of services. How do we measure the health of a population? Okay. Two of the terms, or some of the terms I really want you to be familiar with, are terms such as fertility and natality. Fertility and natality, natality meaning birth rates. Okay, we know fertility, of course, if a woman's fertile, she's making babies, that increases the population. Natality, though, has to do with the number of birth rates. Life expectancy, how long an individual is living on earth once he or she is born. That has to do with life expectancy. Okay, and then we go on to having what we call birth weights. That's also a measurement of health population. And pretty much birth weight is an indicator of a population's health. With low birth and very low birth weight babies who are at higher risk. Low birth weight and very low birth weight babies are at highest risk when it comes to statistical information for birth weights and how we measure that. Then you have, as another way of measuring the population, you have morbidity and mortality. Now, morbidity is incidence of disease. Morbidity is incidence of disease. So one measure of morbidity is the limitations that's caused by chronic conditions. So when you have individuals that have chronic illnesses or conditions, those type of statistical cases are monitored all the time, because that's how we get our information that lets us know based on age or population and the number of years this individual had this disease, they lived this long. We get those statistical information because morbidity is a way of measuring the health of a population. Is it what is it that's causing the high numbers of cardiovascular disease? What's causing a high number of strokes? Where do you see it mainly in? What age group? Is it the 30 to 35, or is it the 40 to 45, or is it the 65 to 70? Then we have mortality. Mortality rates, basically by definition, is the number of deaths in a given time or place. So when we look at abortion rates, of course, statistical wise, they're much higher in black women than Hispanic or white individuals. You also expect abortion rates to be higher in unmarried versus married women. Utilization of health services. By gender, women utilize services more, especially during reproductive years. When it comes to age, the younger the person, the more services they use. Not that they don't use any when they get older, but the younger you are, the more services you tend to use. Race and ethnicity. These diseases are prevalent in certain populations. So guess what? Sickle cell anemia, those patients utilize a lot of health services. Socioeconomic status. Normally, individuals that don't have as much income and have very little financial resource, they're not going to utilize services as much. Versus somebody that's got money, got good insurance, etc. They can get a little sniffer. They go into a doctor, pay their $25 copay. That's just the way they do it. Now, that pretty much ends everything for chapter 2. Now, that was short, sweet, and to the point. Chapter 3 is going to be even shorter. because all it talks about really quickly is access to health services. How do you define access to health services? What are some dimensions of access to health services? So let's get started. So how do we define access? Basically, we define it based on several factors: your geographical factors, your physical factors, the financial dimensions. But I can tell you what the main focus is. Who can guess? Yes. Financial access. No money, no access to health service. Because you, in your mind, you try to figure out how am I going to pay for it. But financial access is the main focus. When we talk about financial access, what are we talking about? We're talking about private health insurance, public or social health insurance, private payments, government-sponsored programs such as Medicare, Medicaid, your TRICARE, your VA. What affects financial access? The lack of access affects financial access. So how does that serve as a barrier for people that have little to no financial income? Well, this is what really happens. So you start out with this doctor in January, and you go here and utilize these services. You don't have any insurance or whatever, and so now you have this stiff bill that you can't pay. You get this bill. You are okay for February and March, but in April you get a little cold. You need to go to the doctor. Hence, you probably not going to go to the doctor you went to in January. Now you're going to go to somebody totally different. Every time you do that, you seeking too many services from too many different providers. And you really need to stay consistent. That's why having a primary care physician is so important, because it keeps you with some consistency. You don't need to go getting advice from everybody, and then everybody has to learn you over and over again. Get with somebody who knows your history, somebody that can help you help yourself when it comes to healthcare services. That's why as managers, you always want to operate a facility where patients feel as though, hey, no matter what, I'm here to stay because I've built my confidence level here. I'm in my comfort zone when I'm here, and I like the staff, I like the manager, I like the physician. So you want patients to feel that you really care about them and their health status, and that you're willing to work with them so that you can have that longevity with them. Another factor that influences or affects financial access to health services is when individuals don't take out insurance, or they fail to elect and sign up for benefits. Because benefit periods are normally like once a year. And a lot of times, unless you got in a very extenuating circumstance, you usually can't just get health insurance in the middle of the year unless you're starting a new job that offers it, and then that's different. But if you're not starting a new job, benefit period has passed, and you decide, oh, well, I guess I'll just go get some insurance in March. A lot of times you can't do that, and it's going to be more expensive for you to go out on your own and get insurance versus getting insurance through. So again, just keep in mind that as managers, when your benefit periods roll around, make sure you get that information out there to your employees. You're not responsible for them if they don't take out the insurance, but you are responsible for making sure you offer it to them. And if you're working for a facility that offers health insurance to employees at a reduced rate, it's your responsibility to make sure you get the information there. Make sure you get the information out to them in a timely manner. If you know the benefit enrollment for your facility is every November, then make sure around a month before or 2 months before, just kind of send out some reminders just to let employees know. You never know if an employee has questions that maybe you can answer for them, maybe you can't, but give them that opportunity to be able to ask those questions in the event they have a question about something. because you want your employees to feel that they're getting all the benefits they need from you. A lot of times people, to be honest with you, a lot of times individuals will turn down jobs if they don't offer benefits to their employees. That's one of the factors when people are looking for jobs and stuff. They're not just looking at how much money is going to be paid and hours I'm going to be working, but one of the questions that they ask is about benefits. And so when you're interviewing individuals and they get to ask them questions about benefits, as the manager in a doctor's office, you need to be able to explain benefits to them. Let them know what you offer, what you don't offer. You need to have some background knowledge about your 401k that's inside your facility, and you need to have some background knowledge about the insurance you offer, the type of insurance you offer. You've got to be prepared to have those conversations. So I want you to just keep that in mind when you get to working in your field and you start your hiring process, and even for the employees that may have been there, but maybe there have been some changes, And I tell students all the time with the healthcare reform and the changes that go on with our government and our national positions and stuff, things change all the time. So, when premiums have to go up, you as the manager need to have that conversation with your staff to let them know, unfortunately, next year rolling around here, premiums are going up. Don't just tell them that, but explain to them why they're going up and give them the rates. Make sure you've done your homework and your research so that you can better help assist them. Now, this pretty much concludes the audio lectures for chapters 1, 2, and 3. I will upload this lecture in the student portal, and keep in mind that you have access to each individualized PowerPoint slides for 1, 2, and 3 in DocSharing. Thank you.